This is a chronic problem that year after year, we've got a very large swath of people in this province and in this country who are struggling to afford the food they need.
Nutritional sciences professor Valerie Tarasic at the University of Toronto once again sounding the alarm over the ability for Ontario residents to access healthy food.
We know that to be in a severely food insecure household is to be very, very much at risk of health problems and increased healthcare utilization.
She's one of the authors behind the report looking at food insecurity between 2019 and 2021. Using data from Statistics Canada's income survey, Tarasic and her colleagues found just over 16% of all Ontario households were food insecure, and nearly half of those households had people in the workforce. 1 in 5 Ontario children lived in a food insecure household. More than 2/3 of Ontario households relying on OW or ODSP as main income were deemed food insecure. And about 4.5% of all Ontario households had severe food insecurity, meaning missed meals, reduced food intake, or days without eating due to lack of money.
Are households that have reported enough problems that we have reason to believe people in those households went without eating because of a lack of food and a lack of money to afford more. So this is a very serious problem.
Despite most of the figures not moving in an upward trend, she says there isn't a decline either, suggesting it's a chronic problem. Tarasic added Quebec's food insecurity rate was 3% lower than Ontario's, something she attributed to the provincial government's move to index all social benefits to inflation. While Ontario residents receiving ODSP are set to receive a 5% increase in rates this year, it comes after several years of freezes by the Ontario government. Not enough to keep up with rising prices, and nothing extra for Ontario Works recipients.
They're still not really committing to indexing. They're not committing to doing anything about Ontario Works. So if there isn't any indexation, those people are effectively getting poorer.
She called for extra boosts to social assistance rates, as well as increasing Ontario's minimum wage to what she calls a proper living wage, and boosting the threshold on income taxes, all to help address food insecurity.
At a time when, healthcare budgets are going through the roof, we really need to be working upstream to pull back some of that. I know that people will hear this and they'll think, oh, all of that is going to cost money. Where is the money going to come from? But remember, this thing costs the province money in terms of healthcare dollars right now.
For more on this story, go to citynews.ca. In Toronto, Nick Westoll, City News.